Welcome, precious friends, to our VIP Health Talk once again. So, before we begin our program on Smiling Smart, I want to keep you all smiling. And as our beautiful speaker today has a bright smile, so let me begin with a joke. A girl asked her dad, Dad, what shall I become? A doctor of the heart or a tooth doctor? The dad said, Of course, you must become a tooth doctor. And she said, Why? Because the heart is so important. And if the heart is not there, the life is gone. He said, Exactly. But if the heart is cured, the patient will not come back to you. But a tooth doctor has 32 teeth. So even if one is cured, they'll come back to you for the 30 plus teeth. So they'll keep coming to you. So I know it's always thought of dentists, they have a lucrative practice. Dentists, oh, they're so expensive. Dentists, they're not easy to get. And friends, that's what happened. For almost a year, I couldn't find a dentist. And now, thanks to Dr. Meghanathan, we managed to find the dentist all across from Malaysia. She's come here on this cold November to keep us smiling smart. And she's a highly decorated dentist. She's an orthodontist and an oral surgeon. So we're so fortunate to have her. So I won't take much of their time. I'll hand you over to Dr. Mega to introduce her. And then you can shoot your questions and let's have an exciting time today. On to you, Dr. Mega.
Thank you, Dr. Hansa, for the beautiful introduction. Now I have a great pleasure in introducing Dr. Esther Tan. Well, she is a dental practice owner situated here in Sabah, in Likas. It's a place called Likas. She graduated her Bachelor of Dental Surgery from Malacca, Manipur. I'm sure you all know where Manipur is in India. It's a branch here, Manipal Medical University. She completed her oral surgery and orthodontic attachment in Malaysia. Her special interests include painless dentistry. Wow, that's wonderful. Children dentistry and cosmetic dental care. She currently serves as a host, worship leader, and educator in a church called Skyline in Kota Kinabalu here in Sabah. With a passion to bring excellence to workplace as worship to God, she has stewarded her clinic, FTS Chin Dental Surgery, for the past 9 years. So she's quite a well-experienced dental surgeon, and is a very friendly and easy to get along person. And you can see her smile, and is always sort of very cheerful. So I have a great pleasure in introducing our dental doctor all the way from Malaysia. Thank you, Dr. Esther. It is now your time. Over to you.
All right. Hi, thank you, Dr. Mega, Dr. Hansel, for the and Dr. Asha as well, for the very friendly, welcoming. It's such a pleasure to be with you all today, and today is really a relaxing session, and I just hope that what we will share tonight will be a blessing to you, and not just you, maybe to your family, people around you, that you yourself can educate and help people around you to understand oral health, dental health better, right? I'm gonna just start right up to screen share and start. Right. So, today we're gonna talk about Dental Health 101. Technically, we're gonna jump right into what is a tooth, okay? As you can see, very basically, you need to know just three important parts about a tooth: enamel, dentine, and pulp. Okay, so the enamel is the most hard layer protector outside, and dentin is the middle layer, and the pulp is obviously the inside layer. Now, human, we have adult and baby teeth. Adult has 32 teeth, as Dr. Asha just said, and milk teeth, baby teeth, children has 10, right? So we're going to cover three dental, themes today, mainly. Number one, dental caries. The second one about your gums. And the third is about oral injuries. And if we have time, I'm going to give you guys a little bit more tips at the end if time allows, okay? Now, the first thing we're going to jump into is dental caries. It's caused by bacteria in the plaque, okay? And they produce all the bacteria will produce acid from all the sugar and food, and that's why people who don't brush they get caries because the acid and the bacteria is not removed in time, and that will result in corroding of the teeth, which is what we call caries, dental cavities. So the treatment for it's simple, just filling. You can see some before and after right here. Okay, it looks relatively good nowadays. I hope dental should be quite good looking now. The fillings should be looking quite natural now. And sadly, if the fillings are like the cavities are not filled in time, they move from the outer layer of the teeth into the inner layer, reaching, just now we said there's enamel, which is the outer layer, dentin, the middle layer, and the inner layer, pulp. Once the caries are not treated within the first two layers, when it reaches the pulp, the most inner part of the tooth, that's when it gets challenging. It gets tricky because filling alone will not help anymore. Because at that time you will feel pain, and people usually which have pain they have a high chance, not always, that the caries have already reached the tooth, the pulp, the inner part. So you can see here, yeah, in this picture, number one, yeah, that's where the cavity has reached from the outer to the inner layer into the pulp, inner surface of the teeth. So you know what we got to do usually, what is more than a filling, and that's called a root canal treatment, RCT. Right, you can see when removing the caries, and the problem is the inner pulp is infected, no good, causing pain. So we got to remove that part and fill it in. And trust me, this is a very, very much more complicated procedure than a simple filling. So delaying the filling or delaying treatment can cause you more time, more complex treatment, and definitely more money. Okay, so if you have any, and the worst of all, some of them, have caries that is super extensive. Sometimes not all teeth can be saved, even with root canal treatment. They may need extraction finally. So I'm just going to jump right in to what I said just now, the cycle of dental neglect. I want you guys to take a good look at this, When the starting of the problem, okay, we're going to go from simple to extensive problem. It's telling you that, when there's plaque, tartar forming, not a big problem. Decay forming, not yet very big, not big problem. You can just do it by, cleaning or even fillings, yeah, it costs you a bit of money, yes. But let's see what happens if you don't, and just and things are left there. So if it weakens the tooth, more tooth structure is lost. You need things that are more complex than fillings, things like crown, which will cost you definitely more. Or if, as I told you, the decay reaches the inner pulp, reaches the nerve, then you need things like root canal plus crowning, or even extractions, which will cost you even more. So as you can see, the money sign increases. So I must say, dental is not the most expensive thing. Negligence is. If everything is treated at the early stage, usually it costs us much lesser than when it's left alone there. And you can see many don't feel pain until the problem has reached the nerve. So that's where things are already quite complicated and not quite extensive. Next, we're going to talk about gums disease, okay? What is gums disease? You can see healthy gums and unhealthy gums, that's the difference. You can even check yourself. I do that when I just saw this picture for the first time. I directly look in the mirror. Since you guys don't have your camera on, you can do that in front of your mirror. Check which one are you. I just look at the front ones and the bottom ones here. And you see which one is that, okay? Do you have healthy or unhealthy gums? Yeah. What is gums disease? It's called gingivitis, okay? Because gums is called gingiva, right? Gingivitis. So you'll see red swollen color. They're supposed to be pinkish like that. Yeah. But when you see redness surrounding your teeth, it's probably inflamed or unhealthy already. So sometimes I hear patients saying, oh, I have bleeding when I brush. Not not because you brush too hard, but because your gums are already weakened by the infection that is already there. So I always tell them, like, if your gums are bleeding, it's probably time that you need to go for a good clean. And that's a good reminder. It's like your body telling you, okay, it's time to go get your clean, that kind of thing, right? If left untreated, this is what happens, all right? It will progress, and the gums area, the red part, is just going to be gone. It's going to be shrunk. Gums are going to be gone, and the gums that's supposed to hold your teeth is gone. So what can you imagine? The teeth, no support, no gums, becomes loose, and you'll have gums recession. That means your gums are receding. The teeth looks longer and longer. Um, and you have the tooth sometimes will get lost over time because they're so shaky and unstable. There are cases like that. So I'm going to tell a little bit about what causes gums diseases, okay? The first one is dental plaque. Okay, it's technically, like this is a technical thing, like colorless layer on the surface. It has germs, and it still can be removed by brushing. But I'm just gonna teach you a very simple test, okay? Just go to the mirror and just scratch on your teeth surface with your fingernail. If there's something on your nails, that's probably plaque. If you don't, then great. Your teeth is clean throughout. Okay, well done. But check, if you have plaque, then you probably will also have this. Look at the bottom of your teeth. Look in the mirror. Like if this is the mirror, I will just look like this. Say ah, and look down. Look down. Say ah, look down, and look inside here. See if you find anything yellow, like what you see in the picture. If you have it, then it's something called calculus. Okay, it's dark yellow in color, and it cannot be removed by brushing because they are technically plaque, but they're already hardened plaque, like hard. And they call it karang gigi in our language. It means like, what do you call it? Rock coral, because they're as hard as coral. Literally, it feels like rocky. Okay, so if you have that, you need to remove them. Otherwise, they will sort of like eat up your gums, and the same thing will happen. Gums is recessed, teeth will get loose, and then you might lose your teeth finally. Treatment is very simple. Scaling, that's all. All right. And there's a big myth here that I always like to debunk, okay? Teeth will erode if you scale your teeth, not brush, like scale. Do you guys think it's true or false? Just scaling will not thin down your teeth. But what always happens when people feel it's thinner, because imagine, you can see this picture, yes? Imagine this whole chunk of yellow thing removed. But this whole chunk is not your teeth. This whole chunk is just the tartar, the calculus, the dirty things, right? When we clean it off, what is the first thing you feel? Obviously, you feel like your teeth is smaller, right? If it's left not like this, but like this, right? It's like I'm just left with a little triangle thing, and why is the gaps in between my teeth so wide? But those are actually not your teeth. And if you don't remove it, it's just gonna eat up more and more gums, and your gums are your teeth is gonna go wobbly. So, although yes, removing the calculus will feel like your teeth is smaller, but in fact, they're just still the normal size. Okay, but you just feel like that because the mass that was the calculus was completely removed. Nowadays we do very gentle scaling, and we do not touch, do not now the scaling device nowadays cannot thin down your teeth, because even if you put it on to the teeth for an hour, you just lay it there and keep scaling, your teeth surface will have no problem. Like a normal teeth, a healthy teeth will have no issues, no problem. So it's not possible for scaling to thin down your teeth, okay? Okay, next, I want to teach you how to pick the right toothbrush. Number one, you see all these numbers, all these labels, soft, medium, and hard. They call it hard nowadays. Always choose soft bristles. And I advise 6 months, but honestly, I usually change mine when it becomes like this. Not so bad, but you can see them like looking super flared out, and they're like really, like really not like a normal brush anymore. And then I don't advise you to store it in a moist, I would say you can put it in the toilet, but with the flushing and all the water just going around, unless you do a closed cap flushing. That means when you flush, you close the cap. Imagine the things that's coming out of the toilet bowl as you flush, and your toothbrush is just right beside. Not advisable. So you can put it into the toilet if you do a closed toilet flushing, and make sure you don't put it flat. Put it standing, because moist toothbrush is technically bacteria partying. Okay, you need to keep it upright so that the brush is not moist, and you can let it dry properly. And when you brush, there's not so much of bacteria. Okay, so brushing wise, technically, I just want to give you a very simple guideline. Teeth has three main surfaces: the outer surface of what you see, the biting surface of what you see now, like where I used to bite, like this picture here, where the brush is brushing here, and the inner surface, which is where my tongue is touching the teeth. That's the inner surface. Okay, so I'm going to show you first the outer surface, where you see, like all you see right now, the inner surface, which is where your tongue touches, and the biting surface is right, let me see, it's not here. Okay, the biting surface is here lah, where you chew our food lah. There's three surfaces. So the outer surface, you just brush in a 45 degrees. What she's doing is technically okay. Or if you want to make it simpler, you can just do a circular motion for the outer surface. Circle left, circle front, circle right. Simple, right? Anyone can do that. Then I like to move directly to the biting surface, just because, it slides easier. From the outside, I go to what you see on the picture here, number 5. I just brush on the biting surface. From outside, circle, and then I go there. To the front, to the back. And then the inner surface, technically you just need to tilt your tongue, your brush a little bit inwards. Can feel a bit ticklish. So just these three surfaces: the outer, the biting, and the inner, near your tongue. That's it. Okay. I want to give you guys a tip that what is the most missed and most dirty area all the time for all patients, all age, all nations, all anywhere, anywho. Okay, that's the one surface that you always see the most calculus and tartar, and that is here, where I asked you to check just now, right there. Yeah, where your tongue touches, like here. I don't know if you guys can see me right here, right on the bottom teeth, inner side, the inner surface of your bottom teeth. That's where, because I think people usually brush like that, but you're supposed to just go like in out, like kind of thing. So when your brush is not oriented, like number 4, do you see number 4? Number 4 in the picture is the right way to brush the front lower teeth, but people have different ways and preferences. So I usually teach my patient to brush like that, number 4. So if you want, you can take a screenshot or anything, take a picture, and go and check tonight. I assure most of us will have a lot of missed, things over there, like tartar or calculus. So that is a tip for you. Brush that area the most, longest. Spend 5-10 seconds more just for that. Okay. Next, okay, you guys saw this. Lastly, we're gonna go into the injury. Okay, so I'm gonna teach you guys to manage. I know this is a little bit off topic, but I hear there's a lot of professionals here, so I assume, if there emergency happens, which is the most scary thing, is when a teeth pops out in injuries, in accidents, and whatnot. So today you're gonna learn how to handle a popped out tooth. If a tooth literally, someone got injured and a tooth came out in the middle of the road, what are you going to do? Now, the first is hold the tooth by the crown, okay? This is what the picture is. Can you see the picture? The tooth actually has a crown, which is the white part, and the sharpie part, which is the inner part, where it belongs inside the bone. That is the root part. So I'm telling you to hold not the root part, but the crown, the white part. Hold it there, and then if it's not clean, you can just gently wash with like tap water if you have to. But if you don't have distilled water or even cold milk, because milk is the pH is good. It's like the body, okay? And if you dare to, when it's clean already, you can actually try to reinsert into the socket. Yeah. But if this is scary, I know not many people dare do that. So if you're not, not comfortable with that, just ask the patient to bite on a clean cloth, just stop the bleeding or whatever, and just put the tooth into either a contact lens solution or into milk. Okay, contact lens solution. I think contact lens solution is not too hard to find, or even milk. Milk also can. Just put it into a milk and just bring it to a dentist. The dentist will do it. Okay, that's just extra info. Okay, we have a little bit of time. Maybe we'll go into the Q&A first. If we have time, then I'll go into this teeth tips part. Okay, let's go ahead. Any questions for now?
Thank you, Dr. Tan. It was so good, so good, We are all mouthful of questions, so I won't waste anybody's time. Let me start with mine. See, I have what is called the gum atresia due to rigorous brushing, they say. So,
Mm-hmm.
what happens is I get severe pain. So, what I do is I start brushing from up, down, with my hand. I do a gum massage up, down, up, and then the pain goes off. It's intense pain, but once I start doing that, out like this, and then I do a circular with my finger. I keep massaging like this, the pain goes off. So what is the need? I mean, tell us something about gum massage. Is it necessary? Could we do it? Should we do it?
Gum massage is technically applying pressure. As you know, any pressure can relieve pain, right? So that
Mhm.
is probably what's happening when you do that. I do still would, if you have checked with the dentist, your local dentist, and they say your teeth and gums are fit and fine, then then you can use that as a temporary, like as at least a relief for you when it happens, right? Because it doesn't
Mhm.
feel good. But
Terrible,
if
yes.
if ever if you have not cleared that there's no tooth or gums problem with your dentist, then I would advise to do so just to make sure that there's no severe issues and whatnot. Um, because usually if I have patients coming in telling me that they have gums pain or teeth pain, um, I would usually, after checking, usually I would say maybe 90% of the time there is a reason for it, be it a small or big cause. There's usually a cause. Very, very minority of them have like just pure gums pain or very sensitive, naturally sensitive teeth. So that's my advice. I think gums massage is perfectly fine. Perfectly fine.
Okay. Thank you.
While waiting, I'll just share and just give you guys some tips. Okay, number one is, why does your gums bleed? As you remember just now, I told you because is it normal? It's not normal. It's gums infection. Yeah, most likely gums infection. Healthy gums are not supposed to bleed. Yeah. Number two, do not brush right after having food because after food, the pH level, acidity level is very high in your mouth. And if you add up a brush to sort of rub onto your teeth, they thin down faster. So I wait for 30 minutes after you eat, let the pH go back to normal, then only you brush your teeth. That's fine. Yeah. If you want to, you can just do a mouth rinse or something, but not brushing right after food. Okay, the next one is the basic three secrets that you can do to just keep a very healthy teeth. Number one, floss first. Number one. Then after you floss, then only you brush. Finally, you rinse. Some people have the sequence differently, but I feel like this is the most practical sequence. Why? If you want to know, you put into the chat box. Um, and for children, babies who like to use pacifier, you must stop at 3 years old, ideally, okay, for a healthy growth of your jaw, healthy teeth. You don't want them to look like, funny, they don't have funny teeth. Stop by 3 years old. You need to brush 2 times. The next tip is you need to brush 2 times a day for 2 minutes, ideally. Soft, and next is you need to use only soft toothbrush or even super soft. Never use medium, never use hard. They are bad for the teeth. Okay. If you want to know why are they bad, put it into the chat box as well. Okay, just always just choose soft. Okay. Why do people have shaky teeth? As I told you, most likely because they have a lot of tartar or calculus that is untreated, and their gums have shrunk too much, and that's causing them to have shaky teeth. And for people who do teeth checkup, I advise every 6 months, minimally lah, once a year. Yeah, so that's all for my tips.
No, I would like to ask a question. I know
Go ahead.
some of at night, mostly in the night, some my children they grind their teeth. Why is that happening? What's the reason for that?
How old is your children?
No, they are adults, maybe 30.
Oh, they're adults. Okay, they're adults. Okay, not I thought children. Grinding is a more of a psychological contribution for adults more, very commonly due to stress or sometimes even difficulty in I wouldn't say that's a minority, mostly due to stress, but minority sometimes they have something called apnea in their like people who have like underdeveloped jaw or breathing breathing challenges or can or when their breathing tract is a little bit blocked out, sometimes the position of the tongue can affect how you breathe at night. Not all the time we are breathing, sometimes so sometimes if people who have less more, I would say more blockage in breathing, that gives them tension and that can cause clenching as well. And so many reasons can cause we call it night grinding or bruxism. But be careful because people, if they have night grinding, you probably want to see if I usually see if patients' teeth are flat, very flat. We're supposed to have nice curves, right? But some teeth are just, you see, like, why are they so flat? It's because they've grind down their teeth a lot. And if I'm saying that they're still at a young adult kind of age, definitely consider night guards. Night guards are things you wear at night, just one jaw, to prevent grinding down your teeth. But honestly, if you say if there's the problem is like usually adults is stress lah. So I would say take a good 30 minutes off your phone and just relax with music, with worship, with prayers, and just relax yourself before you sleep. Sometimes that already helps. Yeah. So, but if you say you want to treat something, you want to treat night grinding, it's probably a night guard, which is like
Okay.
a mouth guard, but you use it only at night. Lah.
Thank you so much.
No problem. Any other questions? You can unmute yourself, but I see Mansi asking, can diabetes or stress affect gum health? Diabetes, affecting gum health. I would say, honestly, if you want to talk about gum health, right? Two main things. I can tell you the main factor if you're talking about gums. Number one is the calculus, the cleaning thing. If you do your 6-month cleaning, that big time affect your gums big time. You have very drastic people who do cleaning and don't do cleaning by the age of 30 or 60 or 50, 40, every decade, like you can see their gums drastically changing. So that's number one, whether you do your routine cleaning or not. Number two is probably vitamin C. Yeah, vitamin C, because vitamin C is it's just part of the vitamin that will contribute to you. You have enough vitamin C, your gums to do well. Not that you should take a lot, okay? It's just that if you have a lack of vitamin C, it's shown in research that, your gums bleed easily. You have something called scurvy. But I think in our generations to be okay. Not too bad, but some does have that. Diabetes affects wound healing most. So I would say probably any wounds, ulcer, more of that, I would say, the wound healing in your oral mouth, or if you have yeah, like I told you, like ulcer or like extraction wounds, the kind of thing, more of that. Stress, night grinding, as we have mentioned, that affects. Yeah, so I'm gonna, I think Mr. George and Sushma are muted,
Yeah.
right?
Yeah. Yesterday I found I found my mouth tightening in the night. I was wondering why. Was it?
Can you describe tightening? What does tightening mean?
Oh, it was getting stiff in the mouth, around my mouth.
There is something? What? Sorry?
I found my mouth tightening in the
Stiff.
night
He
in the
said
night
it
while I was
became
sleeping. I don't know how to explain that, but
he says it was becoming stiff
stiff.
and
Yes, yes, yes,
hardened.
yes, yes,
Stiff
yes, yes,
and
yes, yes.
hardened. Right. At night. Only at night?
Yeah, yeah. That's a one-time experience. That's all right. I was just wondering what it was. Yes.
Is there a trigger factor? Like, is it
Uh,
colder, or it could also be like a cram thing, a very basic thing. Like sometimes, lack of, it can be like a cram thing. Tightening can also, I mean, it sounds like muscular related lah. But if it's only a one-time thing, usually don't be too worried about it. It only, I think if it repeats and repeats or at a specific time or thing, then probably it's concerned. But if it's only a one time, I would say pray about it. It will be gone, and I believe it will be okay. Yeah.
I
But
think
if
yeah,
it
what
yeah.
he's
comes,
I
worried,
really didn't
what
worry about it.
I think what he's worried is it an early stroke?
No, no, no. I never even
oh,
thought of the stroke.
oh, in Jesus' name, it's not. Okay?
No,
In
no,
Jesus' name, it is not.
it's not.
Okay.
Not.
It will not be.
I think he must have taken some sweets.
Oh,
Sweets.
Oh,
That's
okay.
why
but
he's
it's
facing.
okay to have sweets though. It's okay to have sweets though. It's okay. I mean, I like sweet stuff too. We just need to make sure you rinse your mouth after you have sweets, and you don't brush directly, that kind of thing. Like what I taught you lah. Do you recommend to take supplements, vitamin C, D, calcium at a certain age? I would say, honestly, I mean, this is not my specialty, but um yeah, I wouldn't want to comment. Like, come on, there's so many doctors here. I'm sure you guys have much better advice than I do on when and what age to take supplements. I honestly, like myself, I only take supplements when I need it. Like, when I'm sick, I take vitamin C, or if I feel like, okay, my calcium level in my blood test is not doing great, or my vitamin D, I do that accordingly. I don't just take them. Which food strengthen gums? As I told you, vitamin C. And harm gums. I would say the biggest harm to gums are not food. They're just bad brushes or strong brushers. People brush down their teeth so strong that their gums recede, their gums get hurt. And they don't know because, if they don't check their teeth on time, I can't tell them in time that, hey, your gums are shrinking. Hey, your teeth is thinning down. I need to check your brush. Are you brushing well? What are you using, And they come to me when their teeth are already halfway worn down, or their gums are already shrinked halfway. And so, I would say, if yes, vitamin C helps. Gentle, soft toothbrush helps, and occasionally, at least once a year, a dental visit helps. Just pop the question to the dentist, like, how's my gums? Do you think I'm brushing too hard? It's okay to ask things like that. Sometimes my patients don't even ask me, I just tell them, hey, you're brushing too hard. Okay, just because I see it. So I think you should ask when you see a dentist, am I brushing too hard? Do you see any signs that I'm brushing too hard? That's a simple question that someone can ask. Anyone else have any questions? I
Kind of
think
What
I
implantation,
was
I wanted to ask which implantation. Generally, we reside in Delhi, actually, New Delhi, capital of India. Like we are offered over here, Austin and Audine, actually, this kind of implantation. It's advice
okay.
from my wife. And
I would say I
any other
wouldn't say
brands actually?
recommend, yes,
Mm.
but the most I would say, if I'm not mistaken, the most like the old school, like the most original, the brand that started implant is probably Ostem.
It's a Korean brand, right? I believe so.
Yes, yes. Hey, wait, wait. Okay, because
Israel also.
because because I don't exactly do my implants, so I
Yeah, yeah.
don't I wouldn't say that. I don't think there's a best or not, because because although, I mean, honestly, Koreans do tons of implants nowadays in Korea. Yeah. The ones that you probably will get is either maybe Germany, or Korea is probably the two most common places that produces implants. And if you want to compare brands, I would say maybe you compare the Ostem is pretty okay, I'd say. At least the other one, I don't think I've heard of. What is the other one?
I think Austin and Odin, Israel. I think one
Odin.
is from Israel, one is from Korea.
Oh, okay. Um, then I would probably uh first ask the dentist, exactly what difference does it make? Which one is he using? Because even if implants, there are a lot of different designs. There are a lot of different technically lah, they have different shapes, small differences, but just ask them, see which one did they carry, what is the main difference. But honestly, on my just my personal, I've never heard of the other brand. I've only heard of Ostem. Maybe just because they are like more actively involved in the Malaysia market. Okay, not saying that the other brand is not good, but um probably I would ask the dentist like, okay, what is the main difference? And in general, which one does he use more? Because no matter how good the brand is, the hands of the dentist makes a difference too.
Yeah, 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 yeah.
Like if he's
Diabetic
used
can,
to
let's say 74-year diabetic woman and been diabetic for past 30 over years, can she go for a implantation?
that depends on her wound healing. Like, is it
Mm.
well-controlled diabetes? If it is, I think it's okay. Yeah, but as you know, there's still a higher chance of failure compared to others, right? So if it's not too big of an investment and I mean there are other options as well, besides implants. Um
Bridging,
People with
that's right.
diabetes and most importantly, bone level. Is the bone even enough? Because the biggest failure of implants is because there's not enough bone. So whatever you put in gets loose. There's it's just a chance. But if her bone is good, her high level bone is good, then okay. But people who have lesser bone, they can opt for different things like bridges, or even nowadays there are conservative bridges, there are conservative bridges that doesn't need to cut down your teeth, that kind of thing. So there's also, dentures if you want to be very, very conservative. Small, flexible size dentures. There's a lot of other options besides implants if and if you want to, you can talk to your doctor about it, like what are the options, which is suitable, how is they should take an x-ray already, right? Like see how is the x-ray, is the bone level enough or not, that kind of thing. Anything else you want to ask?
Dr. Esther, what toothpaste do you recommend?
Honestly,
What?
toothpaste, right? For sensitive toothpaste people, like people with um sensitive teeth, you can use uh I think Sensodyne is probably the most reputable for sensitive teeth, but I don't recommend sensitive toothpaste usually unless you have been to the dentist. The dentist say, "Oh, your teeth has no problem, no cavities, but you're still feeling sensitive." Okay, then probably you use Sensodyne. But otherwise, to be very honest with you guys, I just go to the market and see what is on sale and just buy whatever is there because honestly, I don't, as long as the teeth toothpaste has fluoride, which every brand technically has, okay, it's fine. It's fine, okay? And I mean, you don't go for the brands that you're not
So do you
comfortable
need
with.
potassium iodide? Sensodyne has potassium iodide. Is that why it is preferred?
And also, yeah, I mean that is one of the reason, but they have they did their groundwork on how to make sure teeth are not sensitive. But others, I believe some can work, but um I mean, why not just go to the OG lah, the original for sensitive teeth. But like for normal toothpaste, I would say whatever brand, as long as you see the word fluoride in it, it's fine. No big pick on what is the best. If I tell you there's any best, then that you need to suspect if the dentist has any bias towards any like any commission or not. Because I don't think there's a good reason for dentists to choose or nitpick on like a specific brand of toothpaste lah. Yeah. I myself am not convinced with what people say before, so I won't do that to you guys.
Some people use salt, is that good? Common
Salt
for
for what?
brushing,
For brushing, for rinsing?
brushing teeth. Yeah, brushing teeth. There's
Ooh,
a
I would say honestly, salt only has one purpose to me. It's only to antibacterial lah. Antibacterial. I do ask my patients to rinse with salt water if they have gums disease at the time, and I cannot prescribe them any, medications for the gums. I'm like, okay, if you're at home, just rinse with salt water. But honestly, they cannot strengthen the teeth. They can only prevent if there's any bacteria. So if your teeth is like bacteria beyond help, like it's already a cavity, not gonna help a lot. You still need to get the filling done before it reaches the nerve, that kind of thing. Yeah.
But they can, I think, impact you if you are a patient of high BP. Can this salt water can impact on that? It can devastate, like it can trigger your BP higher.
Oh, I doubt so because if you don't swallow it, it should be okay because it's all external. But honestly, it's very salty. It's not enjoyable. And if I wouldn't do it lah, honestly, I myself. If you want to rinse, get something a little bit more comfortable, like mouth rinse is a better option than because it has much more properties that you need, right? Salt water. So because you're right, because although it's external, after rinsing and all, you still feel the saltiness and you still ingest it technically. Not a big amount, but um it's not something I would recommend to do lah. It's not like it's so good that you should do it. No, not really lah. But if you brush well and floss well, I think even if you don't rinse with salt water, your teeth is still gonna be great. Okay.
So that means Listerine will be good. Listerine. We should adhere to this product, Listerine.
Again, it's again the same type of. I wouldn't say I recommend any specific brands, but as long as they have something called chlorhexidine. Chlorhexidine is technically what the main antibacterial component. I'm good. So just find any brands that you want to try. You can be a bit adventurous since it's external anyways, right? Just try with something simple. You don't need to go for the most like expensive or the most popular. I think any brand is okay. But if you want to start with, I would say Listerine is easy because they're available everywhere.
We have a quality problem actually over here.
Ah, I
Even
see,
with
I
the
see, I
brand
see.
and non-branded, there is a huge quality problem in India.
I
So we have to
see,
be
I
very
see.
careful. Yeah.
Oh, I see. Then okay, let's start with Listerine then. Then my advice is okay. In case because yeah, I don't know the market there, right? So start with first Listerine. But I do have an advice on mouthwash is if you don't like anything too spicy, usually the green tea flavor should be quite friendly to first time users. I don't like the really really spicy thing, so I just usually go for green tea. The others just burn for me. So some people like it. My husband loves it. He likes the spiciness, the mintiness, but I'm like, ouch. To me, it's all ouch. I have very low pain tolerance, so I usually go for the super gentle, flavors.
What about teeth that keeps breaking? Suddenly, very easily. I've had once it broke. My husband had once it broke. Then do we have to go? We went immediately. Do we need to remove it, or for my husband it just fell off by itself? In senior years, does it break easily?
Um, in senior years, it tend to happen more because gums might not be as strong as youth time, and the teeth structure might be more worn down than youth time. But if it breaks, I would say if the teeth structure is still there, you can still fill it up sometimes, or just do a crown over it or protection over it. Those that we usually will get advice to remove are like those that has no teeth left. You literally see no teeth.
Yeah.
But even so, I recently did a case where because he has bleeding problems, not advised to extract. So even with a gum level kind of remaining little bit of teeth, we still build up because he needs the front teeth to function daily, but he cannot take bleeding. So there are still different ways of managing different circumstances for patients. So yeah.
Thank you.
Okay. Any
Dr.
questions?
Tan, my son is
Yes.
18 years old and already he's
Okay.
got all the 4 wisdom teeth, the upper and the lower, but
Okay.
it's not aligned. I don't know these. My younger one also is getting the same problem. It's kind of lying down, it's not standing
Yeah.
straight. So it's biting into his alignment and his cheeks. He's biting his cheeks. So he went to the doctor last 2 weeks back, pulled out one side of it because I think if the upper is pulled, even the lower has to be pulled. So the doctor said, anyway, it's not of use to you. You're not able to bite, but then it's hurting your cheeks. So we remove it. Now, the other side also, the same problem is happening. I mean, at 18, 4 teeth minus him, I don't know if it is a very safe thing. Will the neighboring teeth also start to shake? Is there any alternate things that he can try to keep it? Or is it okay to just remove, discard, and be done with it?
Honestly, wisdom teeth, usually I would ask people to keep, there's no issue of keeping them in, even if they're not in use, until the only time I would advise their removal is when, like your son, um, problems are arising from it. Some problems can go away with time, some cannot. Yeah. So, if there are recurring issues, recurring pain, discomfort, and one very key thing is those slanted teeth, you need to see if they actually cause decay on the neighboring teeth. Because imagine teeth like that, slanted, a lot of food stuck in this area. Most likely the innocent front teeth or the innocent neighbor teeth will be decayed over time if the food is stuck there and you cannot clean it properly. That is why there are sometimes, yes, removal is necessary. Um, but I would say if you're worried about losing for what's the impact, honestly, besides the healing time of the surgery and like the only that I don't think there will of course, there's also the risk of hurting your nerve, right, during the surgery. I believe the doctor has told you when you remove wisdom teeth, there's a chance it will injure the nerve. That's the risk. But besides that, I don't see any big problems of having all the wisdoms removed. As a preventive measure, it's fine as well. It's acceptable. Because they really do not help a lot lah. And most of people's like wisdom teeth are not easy to clean. So, I had mine removed. Same issue. I only
I don't know.
dread
In
the
our times,
healing.
it's not very much heard of. Like, only with age, teeth fall off. But I saw even there a lot of youngsters were sitting and pulling off their wisdom teeth. As it is, I feel this generation lacks a little wisdom. And then pulling off all those teeth, I was wondering.
Oh,
But
not
yes, as
bad.
you told,
Okay.
the doctor said it's going to hurt his neighboring teeth with a lot of decay might
Okay lah.
happen. So pull it off. Yeah.
Okay lah.
Thank
If
you.
if that is the main concern by the doctor, by good faith, I believe, it is true. And I would say it's all right. It's acceptable to do that. Yeah. I would do this. I would advise the same if I already see that it is injuring the neighboring teeth as well. But one thing I would take note is how close is the tooth to your nerve. That's all. Just that.
These doctors were senior doctors. It's the best in Delhi, AIMS Hospital, Mega. So he was just
Should be
doing
all
it
right then,
like
right?
pulling a hair off, like, just come get it done. Like he was doing almost
Yeah,
4,
yeah.
5 patients simultaneously. My second question is my younger one who's 14. Even he has alignment issue. He wanted to go for braces on the top, jaw, but the doctor saw that and he said, actually, your top features are good. It's your lower jaw that the inclinations have gone in. And one of our good friend, our prayer partner, she said this younger generation has this problem because they wear heavy bags. India still has the culture of carrying, 4, 5 kg of bags on young shoulders. She said that could be the issue. The lower jaw is inclining backward and it has lesser space in the jaw when it inclines backward. And maybe that's why the wisdom teeth are giving this issue, because I saw a lot of young kids there in the hospital, 10, 15-year-old kids coming for the same problem. Like, they have Is that a reason? Does that happen because of the heavy bags they carry on their shoulders? Does the jaw go back? Or I don't know what to say. Yeah.
Underdeveloped jaw is has many reasons, but the one that I would say our line of thought wouldn't go directly to the back of the head. We would usually focus more on developing habits, genetics, um, any habits like thumb sucking or mouth breathing. All those small things from young can cause underdeveloped jaw, whether top, bottom or top. And although I cannot say for sure is carrying heavy bags um the cause, I can definitely say that that is not the solution. If, like not carrying heavy bags anymore will not exactly help on that, right? But yes, it's a theory, I'd say. I respect your friend's theory as well. I honestly am not that specialty to guess, but if it's already happening in 10 years old children. Oh, actually, 10 years old is a good time to do preventive. That means jaw expansion or yeah, we can actually expand your jaw growth if the children has not hit puberty. So I don't know if you have pediatric, or pediatric orthodontist there. They can do simple things, like appliances to help expand the jaw, whether it's the bottom or top line. Yeah, they're still in time to do that instead of doing surgery or whatever, like you can do surgery, but they're still 10, so we usually take
My
more
son is
conservative.
14, so they said we should have come when he was 10, but then the thought of, all these things look complete. He's not that bad, except he's got a big nose, so it makes it look like, he's got a small mouth or a lower jaw. So the doctor just consoled him and sent him back. But I was just concerned because it's happening, in majority of the kids. Thank you so much.
Okay, interesting. Thank you for letting me know as well. Right. Anything else?
Thank you. So it was a wonderful session, and all of us know I'm an anesthesiologist, and we are grateful to the dentists who are the ones who taught us, gave us nitrous oxide because of pain, because the most painful problem in life is the dental problem. So they were the ones who discovered all the anesthesiologists, and ether, the one who found ether, the father of anesthesia and pain, is actually a dentist. So we're so grateful to dentists. Without them, you will never have your pain removed during surgery. So thank you, Dr. Esther. I wanted to ask you about conscious sedation and painless surgery, but then there is no time. Maybe another time we could ask.
Maybe another
So,
session. We can have another
yeah.
session with Dr. Esther.
Yes, maybe we should do that. So, Dr. Sashi, are you still here? Can you can you sing the Aaronic blessing and close this session with prayer, please?
Okay, sister. Thank you, Dr. Hansa. Let's pray. Our Father in heaven, we thank you for this wonderful Lord talk that we had from Dr. Esther about our teeth and how we need to prevention is better than cure. And thank you, Father, for the many minute details she touched upon, and it was so useful. We thank you, Lord, that actually it's so important as Christians because you're the one who puts a smile on our faces. And we thank you that the dentists keep it beautiful. Thank you and praise you for this time. We thank you for Dr. Hansa, coordinated this whole program, for Dr. Megha, and all the others who made it a grand success. We ask this in Bishop Meshua HaMashiach's name. Amen. Let's receive the Aaronic blessing. May the Lord bless you and protect you. May the Lord cause his face to shine upon you and be gracious to you. May the Lord lift up his countenance towards you and grant you peace. Evarechecha Adonai vishmorecha. Ya'er Adonai panav alecha vihuneka. Isa Adonai panav alecha vayasem lecha. Shalom, shalom.
Shalom. Amen.
Amen.
Amen. Thank you. Thank you once again, Dr. Esther. It was such a lively session. You were so good, and we hope to have you again with